Welcome, everyone. Thank you so much for joining us today. So, today's webinar is on navigating fertility and the impact on couples. Perfect. So, I'm very excited to introduce our speaker for today. So, we have Dr. Arielle Buch-Frohlich with us today, and she is a clinical psychologist licensed in Ontario and Quebec. She completed a doctorate in clinical psychology from the University of Quebec in Montreal and received clinical training from the Sex and Couple Therapy Service at the Allen Memorial Institute. Dr. Arielle specializes in sex and relationships to help individuals and couples thrive. She aims to help young couples through the transition to parenthood with expertise in fertility, perinatal, and postpartum mental health. She also assists cancer survivors with sexual, relational, and fertility health. So thank you so much, Dr. Arielle, for being with us today, and I will hand it over to you for the presentation.
All right, thank you so much for having me today. So welcome everyone. So today what we're going to cover is we're going to talk about the stressors of cancer and fertility, what some coping strategies might be to use for yourself individually, and then we're going to talk about the couple. And we're going to talk about communication in the couple, we're going to talk about teamwork, decision-making as a couple, intimacy, and support. So who is this talk for? It's for all of you, right? So specifically couples who are trying to conceive, who are in fertility care or who are considering it, individuals and couples navigating cancer or survivorship, or really anyone supporting a partner through treatment. So what does the journey look like coming from cancer with an idea of fertility? And I want to specify that it's not, one size fits all. Everyone could have a very different experience. This is just a little bit of a segment of, how it might look, but for any of you might have had it different. It might look different. You might be at different stages right now. So just an overall kind of look into what this could look like, but it could start with your diagnosis of cancer. And once you have that diagnosis, you might have had to make fertility decisions in terms of, do we preserve our fertility? What does that look like? What is it going to look like? Are you at the point of wanting to start a family right away, or is this something you want to think about in the future? You might have then proceeded to have the cancer treatment. You might be in survivorship and recovery. You might be at the point where you're looking now to say, okay, how do we have the treatment for fertility and we want to start having our family? And what are some of our family building options? So what are the stressors that you are all dealing with? And again, this might be very different for each of you. It's not one size fits all. I really want to stress that in terms of saying everyone has a very different experience. However, we also want to normalize some of the stressors that you're going through in terms of understanding that you're not alone in this. So in terms of cancer, there could have been body changes. There could have been side effects from medications, from the treatment, from the cancer itself. There could be a fear of recurrence. So anxiety, depression, feelings of hopelessness, feelings of anger or frustration. Why is this happening to me? You might be experiencing role shifts in your couple. So from going from simply partners or a partnership to going into that patient and caregiver role. And what does that dynamic look like for you? When we talk about stressors for fertility, we're talking about different pieces, right? So it might have been that conversation that you're having about fertility preservation. Do I do it? What is it going to look like? How is it going to feel? There might be stressors in terms of it's a matter of time and it has to be done instantaneously, not really having time to think about between the diagnosis to actually doing the preservation. So it might all be going really quick. Or on the other end of things, if you're actually going through the fertility treatment right now, you might be going through cycles, medications, procedures, timing pressure in terms of timed intercourse, if that's something you're experiencing. Overall, you might be experiencing stigma and silence because unfortunately, we're not talking about this enough. We're starting to have these conversations a little bit more, But I'd like to really hone in on the fact that I don't want you feeling alone. I don't want you feeling like you have to do this in silence. And so, we're here to be supportive, and we're here to open up this conversation so that we normalize a little bit what you're going through, which means that understanding that these are things you might experience, you might have already experienced, you might experience in the future. And so, how are we going to deal with it? And there could be a huge financial and logistical strain that comes both from the fertility piece, in terms of, we know, unfortunately, it is costly, both the preservation and the fertility treatment itself in Canada, as well as any medications that go along with it, as well as the fact that you might have to miss work for appointments to deal with the cancer in terms of your treatment. Right, there might be so much going on for you and your partner, and we understand that this is a time of a lot of stress. So, how do we cope with stress? So, first of all, I just want to do a 60-second reset with you all right now. So, if you can take a deep breath, if you can just ground yourself. So, if you're sitting down, plant your feet on the floor with me right now. We're going to feel our shoulders, maybe try to get into the back of the chair. We're going to take a deep breath, go inhale and exhale, counting to 10 each time, just to really reset and be in the here and now with you all. So that's kind of called a grounding exercise, and that can be done along with mindfulness techniques. Um, we can talk about emotional regulation, of how do we deal with the anxiety, how do we deal with frustration if that's coming up with you for you. How do you learn to relax in those moments, which I know is really hard, or it can be very hard? And how do you take care of yourself? So, how do you do those self care things? Perhaps it's reading a book, maybe it's distraction, maybe it's social interaction. There's a lot that we can talk about in that. But I just want to give you just a little thing for today, of a takeaway of, okay, how do I cope with all the stressors that are going on? So, what is the emotional landscape looking like in your couple right now? And again, this is not one size fits all. So, I do really want to caution that for some of you, things might be going really well. And so, it's just more of a taste of what might be coming up for some of you, what you might have had in the past, what you might have in the future. So, in terms of the couple, what are they maybe looking at? So, it could be ambiguous loss, right? So, when you have cancer, or if unfortunately you've had a loss in fertility, or the loss of potential of fertility, it's the feeling of, okay, well, how do we proceed? How do we change our life goals, the meaning of our life? What is it going to look like from this point on? So there might be grief around the imagined future, in terms of, it wasn't the future that maybe you saw for yourself or for your partner. It wasn't what you had planned. And so that's something that we can talk about in terms of, with an ACT mindset, which is acceptance and commitment therapy, of looking at, what are your values right now? What are your life goals right now? Understanding that things have changed, and acceptance that things are changing. And how do we be flexible, and how do we change the course of what we see for the future? There might be identity shifts between you and your partner, in terms of maybe now feeling like the patient versus before you were, you know, just every day your normal self. Or maybe now you're the caregiver. And so, what does that mean for you? What does it mean to have this dynamic in your partnership? There might be fear of, what if? So, what if I can't have a baby after having had cancer? And if that was something that was so important to me before, how am I going to proceed at this point? There might be hope, in terms of keeping that hope and hoping, and making sure that we have space for hope. But there also might be disappointment in terms that we know that the fertility journey and cancer journey, each of them can be roller coasters in terms of your emotions and in terms of everything going on. There's ups, there's downs, there's in between moments. And so, how do you keep hope alive? And how do you deal with any disappointments that might come? And what happens when partners cope differently? So, I see a lot in my office in terms of often, not always, but often one partner might react differently than the other partner, and each of you might be feeling very alone in your silos of experiencing, distress or anything else that is happening right now on this roller coaster that we're talking about. And then how do you relate to each other? How do you understand each other's experience? There might be someone who's a pursuer versus someone who's the withdrawer. So if we look at EFT, which is an emotionally focused therapy in the model there, what happens when one of you is more the pursuer, meaning you're trying to approach your partner, you're trying to talk about things, you're trying to share maybe your grief or your anger, or your frustrations, and the other partner is withdrawing. Maybe they're avoiding, maybe, or maybe they're too anxious to deal with it, they don't know how to deal with things, and you guys get into this cycle of pursuer versus withdrawal. There might be fixing versus listening. So maybe one of you is the problem solver and goes, okay, well, I have to fix everything, right? Whereas maybe the other partner is saying, I don't need you to fix something. I just need you to listen. I need you to support me. I need you to be here with me while all these difficult things are happening to us and around us. There might be overcompensating versus shutting down. So again, maybe one of you is shutting down and going, okay, well, these are things that I cannot fix. They're things that I cannot control. They're things that are happening to me. And so I'm shutting down and I don't know how else to deal with things. Whereas maybe the other partner is going, okay, well, I have to be Mr. Do It or Mrs. Do It. And I have to overcompensate for the fact that my partner is shutting down right now. And so, how does that work in your partnership? You might each of you have different timelines for processing. So for some people, maybe they're processing, for example, that diagnosis, maybe they're understanding it in a different way than the partner is, or they're taking in things differently at a different speed. And so how do we allow for both partners to process and both of you to understand and help each other understand and help each other, have empathy and have each other's perspectives as well. And often I just hear we're speaking different languages. So how do we have a really good communication script? So this is just, one little tool that you guys can be using. And it's the 5-step good talk script, right? So coming to your partner before kind of unloading everything at once, and that might lead to overwhelm, that might lead to that dynamic we were talking about in terms of the pursuer versus the withdrawer. So if you can kind of start from basics and go, first of all, to my partner, is now okay for you? Can we do 15 minutes right now of talking? Are you available to me? Asking that is often really important because it's opening up the space. It's also understanding your partner's perspective, right? Because your partner might be super busy with work or with other things going on, and it's not that they don't care about you, right? Which is often the assumption we make when we start to do this communication and we go, what? My partner is not listening. My partner is on their phone. My partner is not available, etc., etc. And we're sitting there going, oh, they don't want to make me the priority. When in reality, it's if we start with, are you good right now? Is now a good time for you? And then we can set aside that time and make this a priority for both of us. And maybe it's not right now. So the onus is on that other partner to say, yes, now is okay and I'm available to you. Or actually, now is really not okay because I'm about to jump on a meeting, but can we talk at 6 p.m. tonight? Right? So making sure that you're putting in that recall, right? And saying, yes, 6 p.m. tonight, it's in the calendar and that works for both of us. That's really important because, again, you're saying, I want to make you the priority. And we're going to start with a gentle start. So, starting with, I'm a little activated right now, right? Because it gives that a little bit of a warning, a little bit of a heads up to your partner to say, yeah, I'm in an emotional state because I'm feeling triggered. There's so much going on, there's a lot of stressors. So, we just want to put that out there so that our partner is able to understand how important this is. Then we're going to name the need, right? So, we're going to say, I feel scared and I need reassurance. Right? So, especially for those who are Mr. or Mrs. Fix It, it's really important for the other partner to say, I don't need you to fix this right now. That's not the goal of this. The goal is I might need some reassurance, which might mean, could you please sit with me and hold my hand? Or it might mean, can you just listen to me, please? Or it might mean something else completely. But it's up to the speaker to say exactly what is your need so that this doesn't go off the rails. And then at the end, appreciation, right? And that's really important because, again, you're strengthening the bond between you. You're saying that really helped. Thank you so much because you were able to feel seen, you were able to feel heard, and vice versa. And again, when we talk about ACT, so acceptance and commitment, we're talking about our values. We're talking about, using maybe an anchor. So, for example, what kind of partner do I want to be today? How do I want to show up for my partner? What small action fits that? We also want to talk about teamwork behaviors. So, how do we act as a team? So, specifically, when we're talking about fertility and cancer, how do we work together? So, how do we have a shared calendar for all the appointments that you're going to be having in terms of your medical appointments? Maybe for treatment, maybe for preservation, maybe for the fertility, but all of that, can that go into a shared calendar so both of you are aware of what's going on? And maybe even having an appointment buddy. So maybe if you can, if both of you are able to take off work, but going together to these appointments is really actually so important and so helpful in terms of that you're both getting the same information at the same time so that one of you doesn't feel like you have to relay all the information back to your partner, which I understand can really impact the mental load, right? Because first you have to digest all the information that was just spewed at you at the appointment, then you have to regurgitate it back out to your partner, and then you have to deal with it on your own. Whereas if both of you are there at the same time, you might understand things differently, which is okay too, because then at least one of you will remember maybe about the injections, and maybe the other one will remember about the medication, right? So having both of you there as much as you possibly can to be doing this as a team, I think is really important. And it's also helpful for advocating for your own health as well. If you and your partner can be on the same page because you're at the same appointments and you're both dealing with the medical provider at the same time. It could be something like an injection teammate, right? So we know, unfortunately, that a lot of the brunt of, the medical workup, if you will, in terms of fertility piece is often on the woman. In terms of, yes, it's her body, in terms of her going through the pregnancy, potentially. And so a lot of it goes on her. But if you as the partner can take onus of doing some of the pieces, right? So for example, giving her those injections, making sure that they're happening, making sure that she's comfortable, that she's well taken care of, that goes a long way to even out that playing field and to making both of you feel comfortable, seen, and heard. It might be something like pick up and drop off support, right? In terms of We just know that there's so much back and forth going on in all of these appointments for your medical health and maybe other appointments too. But so if both of you are there doing all of this together or as much as a team as possible, well, that's really helpful too to have you both on the same page. And the same with the task sharing. So again, carrying that mental load together and bearing the brunt of the responsibility together as a team is often really helpful to make sure that you're also feeling emotionally connected. There might be decision fatigue. So that might be also something that you're dealing with in terms of, so if we're going to talk about fertility after cancer, there might be embryo decisions that you have to make together as a team. There might be genetic testing that you're going to have to go through. There might be treatment pauses, protocols, medications, timelines that shift suddenly. So how do you make these decisions together as a team? So first of all, even though I understand that there's usually a lot of pressure in terms of time pressure, other cooker pressures that are on this, how do you slow the moment down? Right? So, how do you again ask your partner, are they available right now? Make a plan together to sit down, let's say today at 6 p.m., and go, okay, can we slow this down? Can we make this a little bit more fun too? Which might mean, I know a lot of couples who have ice cream when they're planning on fighting, arguing, in terms of just sweetening it up a little bit. Maybe it's ice cream, maybe it's a glass of, wine if that's permissible. I'm in no way saying to be, alcohol or anything else, but just making it pleasant for both of you to be able to sit down together. And then you're going to name your options out loud. Maybe it's about agreeing on a good enough criterion, right? So remembering that it's not just black and white, it's not all or nothing, but finding some kind of middle ground where both of you can land comfortably. And maybe you're making a micro decision today, and then you're going to review it on a set date later. So, what happens when intimacy pauses? Right? So if we're talking again about cancer and we're talking about fertility, that it comes up in this journey for both for you guys, what happens when that intimacy pauses? So can we normalize the grief? Right? So again, talking about grief, talking about the fact that your dynamic has changed, about the fact that maybe your timeline has changed in terms of family building. Maybe you have to push it off for a few years to deal with the cancer first. Maybe it's about, having had a loss or anything else that might come up in this journey. How do we talk about the grief? How do we name the grief so it doesn't just sit between you, right? Like the elephant in the room, but that we're actually naming it out loud. We're processing it together. And then we're going to rebuild slowly. Having gentle check ins, right? How are you doing? How am I doing? How are we feeling about the relationship? How are things going for you? Do we feel connected? And just a reminder to always have safety first. So, talking to your doctor or your healthcare provider in terms of just what's kosher, what's not kosher, what's okay, what's permitted, what's not permitted, so that no one gets hurt. So, let's talk about the impact on intimacy. Right? So, if you've gone through cancer, there could be sexual health changes that go along with it. So, that might mean low desire, it might mean vaginal dryness, pain, fatigue, changes in arousal, or changes in your orgasm. It might mean that sex became medicalized if you're going through the fertility piece. So, maybe a loss of spontaneity, monitoring, timed intercourse, task oriented sex, emotional shutdown risk in terms of, maybe you've put your emotions aside because you need to have sex right now for making a baby purposes. And so, how do we deal with the impact of that afterwards? There might be body image pieces that come up as well, both for the cancer and for the fertility. So there might be hormonal bloating, there might be weight shifts, there might be bruising, injections, surgical scars, identity disruptions. So how do we deal with all of that? And then, as we've already named, the caregiver and patient roles in terms of how do we name the role shift that has happened? How do we come back after we're, done treatments? And how do we schedule some non-care time? So, as in, schedule time that we can move away from the role of caregiver and patient and go back to being us. So, first of all, how do we reimagine intimacy? So, I like to talk about the pillars of intimacy. So, in terms of really defining that there's three pillars of intimacy, there's the emotional intimacy. So, talking, connecting, you know, feeling connected on a different level with your partner than with anybody else. Then there's the physical pillar. So, when I mean physical, I'm talking about affection. So, maybe holding hands, kissing, massage, something that you would do with your partner, not with anybody else, but that isn't, in fact, sexual. And then sexual is the third pillar of intimacy. So, I like to talk about being pleasure focused and the good enough model. So, how do we have small touch rituals, right? That might include affection. So, maybe staying on the affection level, making sure that both of you are feeling good, no one feels pressured. It might be affection versus sexual in terms of stating at the beginning, I'm really looking for some affection right now. I would love to have sex with you. I still, see you in that light, but right now is not a good time for me. But I really would appreciate some closeness with you. Talking about mindfulness. How do you slow things down? How do you feel pleasure? How do you know when something is off limits? So that pain is a no go and we're not going anywhere near the pain. So putting boundaries in place and going, okay, well, you know, maybe if I had breast surgery, then maybe we're not going anywhere near the breast area because that's too much for me right now. Maybe I become too emotional, or maybe it still hurts. However, maybe a caress on my belly, or a caress on my shoulder, or just, kissing or making out, or penetrative sex, if that still feels good. If any of those things still feel good, we can do the things that feel good and not do the things that cause pain or cause any kind of other harmful emotion. Giving yourselves permission to slow down, right? So remembering that Rome was not built in one day. And, over the course of a relationship, things change, especially when we're in long term relationships. So, how do we slow down? How do we learn how to reconnect with our new body? How do we reconnect with our partner's new body? But in a slow way that is not pressured, that doesn't feel like it has to be done instantaneously. It doesn't. It can take months, it can even take years, and that's okay. How do we give it that time and the space that it needs so that you come to a place where you feel good about your own body, you feel good about your partner's body, and you feel good about having pleasure together? And when we're talking about pleasure, we're talking about pleasure without goals, right? So we're not looking for that orgasm, we're just looking for things to feel good. So, again, that good enough model of going, if that feels good, then that's great. If it doesn't feel good, then we're not going there. So, an exercise that the two of you can do together is sensate focus. So, when we're talking about sensate focus, we're talking about mindfulness. We're talking about so how do you do it? So, first of all, you can set a timer for about 10 to 15 minutes, no more than that, where one of you is the giver, one of you is the receiver, and you set the limits ahead of time, right? So you will talk about, okay, maybe today we're doing everything with clothing on only. We're not going under clothing. We're not touching genitals. That's off limits. We're starting there. And so maybe that starts with a light massage on on your arms, on your legs, on your ears, on your nose, right? You can talk about the things that are inside the limits and things that are outside the limits. And so when the giver is giving pleasure, that means touching the other partner, they're focusing on receiving the partner's feedback, right? So listening to the partner and going, yes, that feels good. And so, yes, we're going to continue there. Or, no, I don't like that. Please stop. And the partner is going to do that. The giver is going to react right away. And the goal is noticing, it's not performance. So, again, the goal is not to have an orgasm. The goal is just simply to connect, to start with some physical connection, and to notice what comes up for you, right? So, again, being mindful. So, the person being touched, really noticing for you in your body right now what feels good, what doesn't feel good, what comes up when it feels good in terms of maybe a pleasant emotion, what comes up when it doesn't feel good. So, maybe a fear or maybe anxiety or distress or anything else that might come up, and being able to say, please stop. Another thing we can talk about is low effort pressure. So, talking about being 10% more comfortable, right? So, again, the goal is not having a all-consuming, Hollywood orgasm, but it's really, again, about feeling good and feeling a little bit more comfortable than you did yesterday or the day before, right? So, rehabilitation into your new body and understanding what will now feel comfortable for you. That might mean having to do different things than you were doing before, right? So, first of all, maybe using a lube. So, if you're experiencing vaginal dryness that maybe you were not experiencing before either the fertility piece or the cancer piece, using lube is really important. For those of you who are in fertility treatment with timed intercourse, making sure you're checking with your fertility care team to make sure what lube is appropriate and what lube is not appropriate, because some of them do prevent fertility, right, in terms of conception. So just checking in, there are some really good lubes out there that are fine with fertility. So just making sure you know which one is which. And the same with moisturizers. So I don't know if any of you know this, but there are vulva moisturizers. So the same as you moisturize your legs, your arms every single day, you can also moisturize your vulva every single day to restore health to your tissue. There's also other tools like the O-Nut. So the O-Nut is actually rings that you put around the penis. I don't have one on me right now, unfortunately. I wish I did. But basically, it's rings that you put around the penis. And so you can adjust the level of rings in terms of, I think it comes with 4, but each one is a separate piece. So you can put on as many or as little as you need. And basically, it creates a little bit of a barrier when you're having penetrative sex so that you don't feel pain, so that you still get the connection. You still also get the ejaculation in terms of ovulation. However, you don't have to deal with pain if if it's a barrier problem or if it's vaginal pain problem. That will create a little bit of a barrier so that there's less pain involved. So that's definitely something that you can look into. And it's, on the market for you to be able to buy yourself. And there's other tools like that on the market as well that are really good. It might mean talking about warmth, pillows, positioning, and then talking about scheduling sensual time when energy is best. So again, really looking at your health, looking at what fits best for you. Maybe early morning is a really good time, or maybe late afternoon, right? But looking at that with your partner and talking about what are the best conditions for sex and when am I going to feel at my best so that we can connect. So outside of intimacy, going back to just regular check-ins, but we're going to talk about a weekly check-in with your partner. right? So again, basics of communication. But going back to, can we check in with the wins and the appreciations of that week, right? So maybe talking about the fertility process that went well that week, or the cancer treatment that's going well. Or maybe it was like a little win of, bumping into an old friend and having a really good conversation. Checking in about logistics, right? So, really making sure that both of you are carrying the mental load equally and understanding what each of you are balancing in terms of logistics. Setting an intimacy intention for the week ahead, right? So, talking about, do we need to schedule some time together? That's a really, really good thing to schedule time. And ending with gratitude, right? So, again, appreciation of our partner, seeing our partner for what they're going through right now, for what they're still doing for you, and just connection. So, outside of today, when to seek support, right? So, in your community, it does take a village. If you can talk with friends, families, community, and religious leaders, let's break the silence about what you're going through right now so that you can gather around people at your side for support. However, while respecting your personal boundaries. So, naming your boundaries with your partner so that both of you are on the same page of going, yes, we can talk about X, Y, Z. No, I don't want anyone knowing about W, right? So, understanding that, respecting each of your personal boundaries in that, but yes, trying to gain support from your community, I think, is a really good place to start. In terms of professional support, so when do you seek professional support? So if you're experiencing persistent pain, if you're experiencing distress, pelvic floor tension, trauma, depression, if you're experiencing relationship distress, that's when it's time to seek help. Let's normalize prioritizing our physical, mental, and sexual health and our relationship. And so, what does that professional care look like? So, it looks like collaborate care. So, that might look like your oncology team, it might look like your fertility team, it might look like gynecology and sexual medicine. It can look like psychological services, so individual therapy, couples therapy, sex therapy. It might look like pelvic floor physiotherapy, like dietetics and nutrition, like naturopathic support. And basically, what you're aiming for is coordinated care so that if you can get your care team to collaborate with each other and understanding what each of your treatment plans are, you're going to have a better outcome for yourself.